of course, the study that we're talking about right now is the changing age distribution of the COVID-19 pandemic in the U.S., looking at the months May to August of this year. So, Dr. Boehmer, maybe if we can just start off, if you want to kind of set up the reasoning behind this trial and what exactly your team was looking to accomplish.
Great. Thank you for that, Kevin. This study aimed to describe the changing age distribution of the COVID pandemic in the United States. And what we found was that the age demographic has shifted to younger age groups. One of the key findings from the study is that the median age of cases decreased nationwide from 46 years in May to 37 and 38 years in July and August, respectively. In particular, we found that young adults ages 20 to 29 now are the group that is most affected by COVID-19. This age group had the highest rate of infection in June through August, and in fact, they accounted for 1 out of every 5 infections.
Wow.
So those, was sort of a descriptive characteristics of how age has shifted, how the age distribution has shifted in recent months. So a second finding of this study is that young adults likely played a role in spreading COVID-19 in their communities. Specifically, we found that in 3 southern regions with increasing cases during June, that the percent of positive tests increased among young adults ages 20 to 39 years, about 9 days before the percent of positive tests began to increase in older adults 60 years and over. So it's important for young adults to protect themselves and to help slow the spread of COVID-19 in their community.
Right. And obviously that's a very troubling finding, of course, and something that I think without pouring into data too much, people can make their own, I guess, conclusions from if we're discussing a lot of the topics of college campuses reopening, of vacations and trips, and some bars partially reopening. Obviously, there might be some implications if we're looking at that age group, but also I think, and correct me if I'm wrong, doctor, but you guys also had a particular focus on the rate of transmission in some southern states during that time period as well, right? And that's an area that certainly had a greater rate of outbreaks in that time period.
Yeah, that second part of the analysis I just described,
right.
We did it just in 3 southern regions. So we used the Department of Health and Human Services regions, and we looked at the Southeast, the South Central, and sort of the Southwest regions. And as you pointed out, there were large, regional outbreaks in those areas throughout the summer.
Yeah.
So, we had observed early on in the surveillance data that cases and the percent of positive tests seemed to be occurring sooner in younger adults, and then were followed later by increases in older adults. So in this study, we wanted to, analyze that and be able to kind of pinpoint the time or the date at which those increases occurred across the different age groups. And the findings were most compelling in the Southeast region of the United States. In that region, we found that adults, we'll say younger adults, ages 20 to 39, began to increase first. About 9 days later, there was an increase among 40 to 59-year-olds or middle-aged adults. And then another 6 days later, there was an increase in older adults, 60 years and over. And so that kind of sequential increase by age group was prominent in the Southeast region. In the South Central region and in the Southwest region, we actually found that the younger adults and the middle-aged adults began to increase within just a day or so of each other. And then the increase in the older adults, 60 and older, was followed 7 days later in the South Central region and 4 days later in the Southwest region.
Right. And regarding the role of, I guess, asymptomatic prevalence when we're looking at the younger populations, that's something that's been more quickly attributed, right, to younger generations of COVID patients, right?
Yes. When we think about the implications of these findings, I tended to think of them in kind of three different categories. So the first was, why are we seeing increased infection in younger adults?
Right.
And that could be attributable to things such as a higher risk for exposure, given their occupations and jobs, and also from social behaviors.
Yeah.
But the second implication is the one you just mentioned. Younger adults are more likely to have mild or no symptoms when they're infected. And so there's a risk that they can unknowingly spread COVID-19 to others, including those who are at higher risk of severe illness.
Right.
And then the third implication is that this is not a benign disease in younger adults. It is true, but young adults who have underlying medical conditions such as obesity or hypertension or diabetes can get seriously ill from COVID-19. And so it really is important that they protect themselves from being infected as well.